When you think about the most intense traumas the human body can possibly face, a severe burn has to be right at the top of that list. It pushes every single system to its absolute breaking point. So the question is, how does anyone survive it? Let's get into the incredible science that makes it possible.
So, okay, the fire's out. But that's not the end of the story. In fact, that's just the beginning of the real battle. What is the body actually going through in those critical hours, days, and even months? And how does modern medicine step in to fight back? That's the journey we're about to take.
The first thing you gotta wrap your head around is this. A major burn isn't just a skin problem. Not at all. When it covers a large part of the body, say more than 25%, it triggers this massive, body-wide crisis that puts every single organ in danger.
So at its most basic level, a burn does two absolutely catastrophic things at once. First, it literally destroys skin cells. And second, it causes a massive, life-threatening loss of fluid and essential electrolytes right out of the bloodstream. For doctors, stopping those two things is a frantic race against the clock.
All right, so a patient arrives. The very first job for the medical team is to size up the damage. They have to answer two absolutely critical questions, and fast. How deep did the burn go, and how much of the body does it cover?
Now this is where it gets really interesting and kind of counterintuitive. A first or second degree burn is what you'd probably imagine. It's red, it's blistered, and it's incredibly painful. But then you get to a third degree burn. It's so deep that it has actually destroyed the nerves themselves. The skin looks leathery or even charred, and there's no pain at all. That silence from the nerves, that is a terrifying sign of just how deep the damage goes.
Okay, so that covers how deep the injury is. But what about how big it is? In the middle of an emergency, you don't have time for precise measurements. Medics need a fast, reliable tool, and they've got a brilliantly simple one called the Rule of Nines. It lets them quickly estimate the total body surface area, or TBSA, that's been burned.
And it works just like it sounds. You basically divide the adult body into sections that are worth 9%, or multiples of 9. So an entire arm is 9%, an entire leg is 18. The front of your torso, 18%. The back, another 18. In just a few seconds, a doctor can add it all up and get a solid estimate of the burn's total size. And that number is absolutely crucial for everything that has to happen next.
And that brings us to the emergent phase, the first 48 hours. This is an all-out sprint against time. The only goal is to prevent the body from going into shock and to keep the vital organs from shutting down.
And the fight starts before a patient even gets to the hospital. These on-the-scene steps are absolutely vital. First, stop the burning process. Cool the area with cool water, and I mean cool, never ice, because ice can cause even more damage. Get any tight clothing or jewelry off before the swelling starts. And finally, cover the wound with a clean, dry sheet to help prevent infection.
While all that's happening on the outside, inside the body, it is pure chaos. A massive inflammatory response is triggered, and it makes blood vessels all over the body suddenly leaky. Fluid just pours out of the bloodstream and into the tissues, which sets the stage for a deadly condition called burn shock.
So what is burn shock? Well, in the simplest terms, the body's plumbing system springs leaks everywhere. So much plasma escapes the blood vessels that there's just not enough fluid left for the heart to pump. Blood pressure tanks, and organs start to fail from a lack of oxygenated blood. It is a full-blown crisis. So how on earth do you fight that? With fluid. A lot of fluid. Doctors use something called the Parkland formula to calculate exactly how much IV fluid a patient needs. And get this, for an average 70-kilogram person with an 80% body burn, the number is just staggering. It's 22,400 milliliters in just the first 24 hours. That is over 22 liters of fluid pumped directly into their veins just to keep the whole system from collapsing. And check out this incredible turnaround. In those first 48 hours, the big problem is low fluid volume, which makes the blood thick and concentrated. And potassium levels spike as it leaks out of damaged cells. But if the fluid resuscitation works, after 48 hours, the exact opposite happens. The fluid that leaked out rushes back into the blood vessels. The blood becomes diluted, and potassium levels can plummet to dangerously low levels. It's a physiological roller coaster. So once the patient is stabilized and the immediate threat of shock is over, the battle enters a whole new stage. This is the acute phase. Now, the fight shifts to 3 new fronts: wound care, preventing infection, and nutrition.
See, all that burned, dead tissue is called SJAR, is basically a 5-star hotel for bacteria. It has to go. This removal process is called debridement. Sometimes it happens naturally, or it can be done mechanically with tools. But the most effective way is surgically, cutting away the dead layers until you get to healthy, bleeding tissue that's actually capable of healing.
To protect that newly exposed tissue, doctors have an arsenal of powerful antimicrobial creams. Silver sulfadiazine is a common go-to. Then there's mefenamic acetate, which is amazing because it penetrates deep into the tissue, making it perfect for electrical burns, but it's known for being really painful to apply. And then you have silver nitrate, which is another option, but it famously stains everything it touches: skin, clothes, everything.
Now let's talk about fuel. The amount of energy it takes for a body to heal from a massive burn is just insane. A patient's metabolic rate can literally triple. They might need up to 5,000 calories a day. That's like an elite athlete's diet, packed with protein and carbs just to power the monumental task of rebuilding tissue and fighting off infection. And finally, once the wounds have closed, the patient enters what is often the longest and most difficult stage of all, the rehabilitative phase. This is where the focus shifts from just surviving to actually reclaiming a life.
There's this quote that I think just perfectly captures this. It says, "Rehabilitation begins on the day a patient enters the hospital and continues for years after they've left." It completely reframes the whole process. Recovery isn't something that starts at discharge. It starts on day one, and it can go on for years and years.
And the goals here are just monumental. We're talking about preventing scars from tightening up and restricting movement. We're talking about intense physical and occupational therapy to rebuild strength. There are often more surgeries for functional and cosmetic reconstruction. And, maybe most importantly, there's the psychosocial support needed to heal from the immense emotional trauma.
You know, modern medicine has gotten so incredibly good at that first part, at keeping people alive. Survival rates from major burns have improved dramatically, but that success has uncovered the next great challenge: helping survivors not just to live, but to truly thrive. How do we best restore function, manage chronic pain, and heal the invisible scars? That right there is the next frontier in burn care.